Hello and welcome to the Connecting Communities podcast. My name is Caitlin and I am the Communications Coordinator for MassHire Metro North Workforce Board. Our organization is dedicated to developing partnerships, generating resources, and advocating for solutions that result in a skilled workforce, prospering businesses, and access to meaningful career pathways for local residents. On this show, we share workforce development stories by speaking with members of our communities who believe in the power of quality employment. Sitting down with us today is Senator Cindy Friedman. Cindy Friedman was elected to the Massachusetts Senate on July 25th, 2017 to represent the 4th Middlesex District, which includes Arlington, Billerica, Burlington, Woburn, and precincts 1 through 2 and 4 through 7 of Lexington. She is also the Senate Chair on the Joint Committee on Healthcare Financing. Prior to becoming a state senator, Cindy worked as a public school teacher, an executive in the high-tech industry, and later served for nearly a decade as chief of staff to the late Senator Ken Donnelly. Described as a straight shooter and a zealous advocate for the people of the Commonwealth, since her election, Cindy has distinguished herself as a thoughtful and policy-oriented member of the Senate. Welcome, Cindy.
Thank you. Nice to be here.
Awesome. So I'd love to start out and just have you introduce yourself and share a little bit about your story. What led you to your current role serving as the Senate Chair of the Joint Committee on Healthcare?
Sure. So I, as you said, I was a teacher and then I was in the high-tech industry for 20 years. And while I was doing that, I was always involved in my community, different issues, was politically active, helping people get elected, and supporting issues that I thought were important to the community and the people that lived in Arlington and where I live, and also the Commonwealth. I left high tech after 20 years, feeling like I really needed to do something that I felt was more in line with my values and had some importance or effect on people generally, increasing the quality of their lives. Mm-hmm. At the time, I helped Ken Donnelly run for Senate, and he asked me afterwards if I would be his chief of staff. I didn't know anything about that, mm-hmm. But since I decided to leave high tech, I said, I'll stay for a couple months and help you get started, and then I'll go figure out what I want to do with my life. I ended up staying for 10 years. He was an extraordinary human being. We were very close. And I remember walking into his office one day early on and saying, mental health in this state is horrible and people aren't getting care and we should do something about it. And because of the nature of who he was, he immediately said, yes, let's work on this. Mm-hmm. And so we did together over the course of 10 years. He passed away because of a brain tumor. He passed away very sudden and very sad. And at that time, it was 2016, we were getting a new president, and I know people were really, really concerned what was going to happen, and I was telling them, get out there, you got to fight, you got to make sure that our values are represented, and I realized I wasn't doing that. So because of this real passion and commitment I had to the work that he and I had done together, and because I was saying to people, you need to step up, I decided that I would do something that I never ever thought I would do, and I ran for office in a special election. And shockingly to me and to other people, I won. And I was really lucky when I came in because there had been a transition in committee membership and committee leadership, and there was an opening in the Mental Health, Substance Use, and Recovery Committee, and so I was appointed to that committee as the chair. And I did that for a couple of years, and what I realized is that to solve the mental health problem, mental health delivery system problem, you really had to look at the whole system, because it was just part of a system that wasn't working. And so when the new president came in, President Spilka, she asked me what I wanted to do, and I said, well, I think I want to look at healthcare because I think that's how we're going to understand how we fit mental health into that. that's how I got into mine.
Gotcha.
And be careful for what you ask for, because you may get it.
Yeah, it sounds like
Yeah.
you and Ken had a really great relationship.
Really, he was extraordinary. I mean, he was one of the kindest people, the most caring and hardworking to really help people to just, when they were in need. And he was a firefighter, and he met every stereotype of a firefighter that you can imagine. So I still miss him.
Oh, yeah, I'm glad you kind of went for it.
Yeah, I know.
So looking back, how did your work in education and technology kind of prepare you for the challenges of serving in the state Senate?
I think that what it did is it allowed me to understand that there are multiple views, and that things are connected in ways you don't really at first acknowledge, but also having lots of different experiences. When you come into something that's new, you really can use those experiences, even though, I don't do high tech, but I understand I understand that you need people to problem solve. I understand, I know that there's processes that you go through where you have to kind of get everybody in the same place, or even that there's a process for solving these problems. And that's an example. The complexity of the problems that we see right now are, they're huge. And if you look at them as like building a very technical and complex system, there are similarities to that. So it wasn't so strange, even though it was a completely different subject. The other thing is people are people, right?
Yeah.
And whether you're in high tech or education or politics, right, people are people, and they act the way they act. And so that's not different. And certainly in learning and education, being a teacher, you really learn that people learn differently, and that they connect in different ways to different approaches. And then being a parent is incredibly useful.
Yeah.
To being an elected official, because there's some times when I feel like I'm being the mother saying, okay, stop right now.
Yeah.
You go to your room, when you're ready to talk to each other, come back and we'll have a conversation. Yeah. So all of those things have added just to my experiences, and I bring that wherever I go, like anybody does.
Yeah. That's great. I like that people are people. I think more people need to remember that today.
It's, I've spent a lot of my life hearing, we should be like business because they're really efficient. No.
Yeah.
They're the same stuff goes on. They just don't have the kind of eyes on them that elected officials or the government does. So.
Yeah. So how do you see workforce shortages in healthcare impacting the broader regional economy?
I thought about that a lot, and Stephen and I, my district director, have had conversations about this. And I think one of the most direct ways is that people need health care, right? When healthcare is inaccessible and unaffordable, they can't get to it. When they can't get to it, they get sicker. When they get sicker, it affects their jobs. When their jobs are affected, that not only affects them because they have sick days or they lose their job because they're sick, but also that business, that entity loses them. And so that's a kind of very connected effect to our economy, even though it's not exactly direct, but it is absolutely a pressure and factor on it. So the better access to care, the more we're able to get care when people need it as opposed to when it's an emergency, the better it is for our economy, because we have a strong, healthy economy that people can stay and work, keep working, and we can all be productive, which is what we need for our economy to thrive.
Yeah, definitely. Kind of thinking about that a little bit more. So every quarter we release a job seeker report, with labor market data from the Metro North region, and we found that healthcare roles are increasingly in demand. Last quarter, healthcare roles dominated the top posted occupations, with majority of the postings for registered nurses, followed by medical and health services managers and radiologic technicians. So what state-level strategies do you believe are most effective for expanding pathways into these high-demand healthcare roles like nursing, behavioral health, and direct care?
I think that there's a number of things that we can do and have done that support those pathways. So first of all, we spent over $400 million in loan forgiveness over the past couple of years for people coming into the healthcare space, primary care and mental health care. Loan forgiveness for, if they come and they work in an environment where at least 50% of the people are Medicaid, they get their loans forgiven over 5 years. Or 4 or 5 years, they're different ones, but and they were real loan forgiveness. It was real, like you're $300,000 in debt as a doctor. We're going to pay that loan, and you're going to stay and work in one of these facilities. That's really powerful. It's amazing how many people want to work in these environments, and they can't because they can't afford it with their loans and their costs of daily living. The other thing that I think we can do, and we have done this, and the Senate has led on this, is free community college. Because what we need to do is we need to build the pipelines. And we need to build the pipelines in a way where people can come in, they can start at a certain level, and then over time they can build up that, they can climb the ladder if they choose to, right? Some people are really happy at a certain rung, and that's fine. But we need to make it easy and accessible to get trained in those spaces. And that's why community college, free community college is so important, because that's where people come in to get licensed, to get certified, to get trained. And we need to make sure that those pipelines are there and that they're open and that they're accessible. And I think that's community college, free community college, I think is an incredibly important piece of that. Having free nursing training is huge, right? Because often what happens is people want to be nurses, or they want to be PAs, or they want to be solar panel installers, but they have to pay so much up front just to get that training. We need to get that barrier out of the way. I think those are really effective. And we need to make sure that our community colleges are set up so that people who traditionally come in and aren't necessarily, they don't have the reading or the math skills, let's say, that when they come to community college, they get trained and they get educated to bring up that, level at the same time. So they don't have to sit in a class, learn a bunch of things that are not related to what they're, for what they've come to school for. Those need to be integrated. So programs that integrate those, where you're not taking a remedial course before you can, get a plumbing license, let's say, that you should be getting that plumbing, you should be getting that skill in plumbing while you're bringing up your ability to read or to do math. So I think those three things are really important. And then to support that, we need to make our cost of living more affordable so people can get a decent job without $100,000 worth of loans. So that piece of it is huge. Housing is huge.
Yeah, we'll talk about that a little bit more later, but it's also interconnected.
It's so interconnected, yep.
So at Mass Higher Metro North, we serve several populations who all face unique barriers to employment. Youth, English language learners, immigrants, low-income households, older workers, and more. So how do you think we can better align future statewide workforce development strategies to more effectively support these communities?
I think it goes back to what I said. We need to make sure, we need to make sure that the learning, that what you need to do for a strong workforce, we need to make sure that they're geared to the people that we're trying to bring into the system.
Right.
English language learners probably have a different set of things that they need to do than older workers, right? Mm-hmm. But what we need to do is make sure that the training that is needed is integrated with what people need to learn. And it's like what I was saying before, it's not just how do you install a solar panel, or it's not just you're going to learn how to take blood, but you have to be able to read the charts and communicate with the person that you're taking the blood from. And there's all sorts of skills that you need in addition to the technical skills. And what we need to make sure is that we've aligned those different skills together so that people don't have to start at one place and, what I said before, get a bunch of training or education or classes that they don't understand how it fits into what they're there to do. And so we have to make sure those things are really tightly aligned. We should be, if you need a 8th grade level if you need an 8th grade reading level, then we need to be teaching you how to do that skill while you're learning how to read those specs, and you need an 8th grade reading level to do that. But don't make people start at the beginning. Right. And then say, so I think that's how we align it. And so it's really looking at, for that particular group of people, what is it that's going to make them successful in the workforce? And then that's what our training program should be aligned to. And it's not a one-size-fits-all, right. Which makes it harder.
Definitely. So during a time when many Americans are being impacted by several federal funding cuts, why do you believe local legislation is so important? Additionally, how can residents work together to advocate for change?
We are facing enormous amount of headwinds from the federal government, and it's the state that's going to have to mitigate those headwinds. And so it's going to be up to us as a state and to municipalities to shepherd our way through this time. And the Senate President had started, in March, had launched an effort called Response 2025, which focuses on what policies and processes we need to mitigate what's coming from the federal government. And she talks about protect our residents, defend our values, and lead us through this time. And so that is why what we do on the state, especially now, is so important. I mean, before even we had this administration, people are very focused on the federal level, but the truth is so much of what affects their lives and what's happened is done at the state and local level, but we don't tend to pay attention to it. Yeah. This has really refocused, I think, a lot of people on saying, okay, how is the state of Massachusetts going to deal with the changes to Medicaid and the changes to SNAP and the changes to taxes and stuff? So that is why it's so important, and it's really important that people kind of understand the context of how they should advocate for change, right? What are our goals and what are our values? And then the advocating for change should come within the context of those values and goals.
Yeah, definitely. And if local residents have an idea or cause that they're passionate about, how can they bring these ideas to the Senate? And kind of going off that, how do you solicit feedback from residents when making decisions?
So I am in the enviable position that I never have to solicit feedback. I get it.
Yeah.
I have a very, very active district, and I do talk to people a lot. People come to me a lot with issues or ideas, and we send out. We're very good at communicating, I think, with our district. Our district director, Stephen Acosta, sends out a newsletter 4 times a year. We send out lots of social media to let people know what's going on. So there's always an opportunity to respond to that. And then it's just through, going to different events in the district, and people will talk to you. If I go talk to the League of Women Voters in Lexington, they have a set of issues that they want me to talk about. And so doing those kinds of events helps you to get, that's where you get the feedback from your constituents. So I think that, being part of those community groups is also a way for people to get involved and then to be able to be part of ideas and giving feedback to me as the senator.
Yeah, I bet being part of that and kind of contributing your thoughts too can be empowering to residents, especially in this time when it kind of feels like it's hard to change anything sometimes. Yeah,
it's really important. And people will come and say, you need to do this. And I will respond by saying, yeah, here's what's going on and here's what the challenges are. And this is, and so this is what we have to look at. And when people understand, when you talk with them and they understand more of the process and understand what more of the context is, then they quickly move into this mode of trying to help you solve the problem. And that's really helpful. Explaining to people, they may come at me and say, you didn't do this. And if I explain to them what happened and what I did and didn't do, I just see a real shift in them going, okay, well, what about doing this? Or what, and they become more of a collective, more of the voices that are trying to help solve a problem. And it's amazing by just engaging people and talking to them.
Yeah.
That you're right, they feel empowered. They're like, oh, let me help you.
Yeah.
And it's really, it's one of the better things that happens in my job.
Cool. So what are some of your upcoming goals in your role?
Well, I really, really want to make a shift in healthcare. I really, my goal is to make healthcare or be part of the process that makes healthcare accessible, affordable, and sustainable. I mean, that's really a goal. And to ensure that while all these horrific things are happening, that we keep our eye on ensuring that people have a roof over their head, food on their table, and are able to get health care when they're sick. I mean, that's really, you really go back to basics when you're under these kinds of threats.
Yeah. And I know one piece of legislation probably won't solve the whole issue, but if you could pass only one major piece of legislation in the next, say, 2 years, what would it be and why?
Well, we only have a year, right?
Okay.
It's over.
Yeah.
I think it would be the primary care.
Yeah.
It's really, it's shifting our focus from, hospital beds, pharmaceuticals, PBMs to primary care and making sure that people have access to really high quality primary care. Now, I can fit a lot of other things in that, right? And I will if I can, but there's a lot of things that's affecting that. But I think that probably right now is the most important thing that we can do, especially as people are going to lose health care or it's going to come unaffordable. We need to make sure that primary care, which is the entry, which is where so many things can get resolved without major interventions or huge costs. We need to make sure that that's strong and sound.
Yeah, definitely. And my last question is, what is your favorite part about working as a state senator?
Well, there's my favorite part is walking in and seeing my staff and everybody just there doing their work and really caring about it. I have different, there are different sides, but one of the things that I love is I went to the Bill Ricca Boys and Girls Club. They asked me to come for a tour, and these two kids, Hishan and Alex, took me around. And there's so many problems, they're so big, they're complex, people are angry, people are scared and frustrated. And so walking into this place where the staff is amazing, they care so much about these kids. The kids are running around, they're talking, they're making things, they're doing podcasts, they're smiling, maybe even they're crying, you know. But it's just such a place of such positivity that, and just positivity and care and all the good parts of human beings. Just really feels, it's really uplifting, and it helps me to remember why I do what I'm doing.
Yeah.
Because places like this exist, and if I can help them, that's great. So.
Yeah. I love that. Well, thank you so much
You're
for
welcome.
being part of this.
You're
I enjoyed
welcome.
the conversation, and hope listeners did too.